Hello everyone and welcome back to our health channel The Healthy Times. Today, we will be discussing an important topic that is often overlooked, typhoid fever. We will go over the signs, symptoms, causes, stages, how long it typically lasts, its diagnosis, and signs of recovery. What is typhoid fever? Typhoid fever is a serious bacterial infection caused by the bacterium Salmonella typhi. It can be contracted by consuming contaminated food or water or by coming into contact with someone who is infected. Signs and symptoms. The symptoms of typhoid fever can vary from person to person, but some of the most common ones include 1. High fever, often above 103 degrees Fahrenheit or 39.4 degrees Celsius, that can last for several days. 2. Weakness and fatigue. 3. Abdominal pain and cramping. 4. Loss of appetite. 5. Headache and muscle aches. 6. Rash of flat, rose-colored spots. 7. Constipation or diarrhea, which can be severe. Causes. Typhoid fever is caused by the bacterium Salmonella typhi. It is spread through contaminated food or water, or by coming into contact with someone who is infected. Stages. There are 3 stages of typhoid fever. 1. The first stage is called the incubation period, which can last from 1 to 3 weeks. During this time, the bacteria are multiplying in the body. 2. The second stage is the onset of symptoms, which typically lasts for 1 to 2 weeks. During this time, the symptoms listed above may develop and become severe. 3. The third stage is the recovery period, which can last for several weeks. During this time, the body fights off the infection, and symptoms gradually improve. Duration. Without treatment, typhoid fever can last for weeks to months. With appropriate antibiotics, however, symptoms usually improve within a few days to a week. Prevention. Preventing typhoid fever involves taking simple precautions such as 1. Washing your hands regularly with soap and water. 2. Avoiding raw or undercooked meat, eggs, and dairy products. 3. Drinking bottled or boiled water and avoiding ice in drinks. 4. Getting vaccinated against typhoid fever. How is typhoid fever diagnosed? Typhoid fever is diagnosed through a combination of medical history, physical examination, and laboratory tests. Here are some of the most common ways that doctors diagnose typhoid fever. 1. Medical history. The doctor will begin by asking you questions about your symptoms, medical history, and any recent travel or exposure to contaminated food or water. 2. Physical examination. The doctor will perform a physical examination to check for signs of typhoid fever, such as high fever, abdominal tenderness, and an enlarged spleen. 3. Blood tests. Blood tests are the most common way to diagnose typhoid fever. A blood sample is taken and sent to a laboratory for analysis. The lab will check for the presence of Salmonella typhi bacteria or antibodies to the bacteria. Blood cultures may also be performed to confirm the diagnosis. 4. Stool tests. In some cases, stool samples may also be taken to check for the presence of Salmonella typhi bacteria. 5. Bone marrow examination. In rare cases where blood and stool tests are inconclusive, a bone marrow examination may be performed to diagnose typhoid fever. Early diagnosis and treatment can help prevent serious complications and reduce the risk of spreading the infection to others. What are the signs of recovery? Recovering from typhoid fever can be a slow process, but there are several signs that indicate that the body is healing and that the infection is being successfully treated. Here are some of the most common signs of recovery from typhoid fever. 1. Decrease in fever. 2. Improvement in appetite. 3. Increase in energy levels. 4. Relief from gastrointestinal symptoms. 5. Improvement in overall health. It is important to note that recovery from typhoid fever can take several weeks, and patients should continue to follow their doctor's instructions regarding treatment and follow-up care. If any symptoms persist or worsen, patients should seek medical attention immediately. Thank you for watching and we hope you found this information helpful.